Hi, Assalamualaikum. My name is Nur Atikah Anwar. So today I would like to present my case study during my internship in Klinik Kesihatan Chukai. So my case study topic is the childhood obesity. For the social demographic or the social history, W is a 14 months old Malay girl's toddler, which is the youngest child between her 5 siblings, with weight of 14.6 kg, height 82 cm, BMI 21.7 kg per meter square. W is an active girl. This is reported by Mrs. Ack, which is W's mother. They live in a village which is near to her mother's sibling and her grandmother house. W in everyday diet history, she drink formula milk and take a few main meals. For the medical diagnosis or history or medical progress, W is diagnosed with obesity due to the rapid weight gain. Her weight is more than 3 SD in the weight for each child, and W is referred to the nutrition science officer in Klinik Kesihatan Chukai to control her weight. So, childhood obesity is remain at the top in global and Malaysian Republic health challenges of this 21st century. The evidence suggests that several early life factors significantly contribute to the development of the obesity in the childhood. Prenatal and infancy stage can be considered as the key step in the determination of the reason for a person to develop obesity in the childhood stage. The childhood obesity can cause because of the family history, such as from her mother or her father, or the family line has the obesity. From the psychological factor, maybe due to the stress or to the kid that cause the kid to eat a lot, or other psychological factor. And the third one is the lifestyle. The lifestyle is important in determining the causes of the childhood obesity. The risk factor for the childhood obesity is first, higher maternal pre-pregnancy BMI. The second one is the excess maternal gestational weight, and the third one is the gestational diabetes mellitus. Obesity can cause the child to be lead to the metabolic syndrome, and second one is to cause the joint damage due to carrying extra body weight over long period of time, and the third one is can cause persistent overweight in later life or in adulthood, and the fourth one is can lead to non-communicable disease such as diabetes mellitus, hypertension, and heart disease. So next, for the nutritional assessment and intervention, the anthropometry measurement shows the weight, height, and BMI of W from the 6 month, from the first referred to the nutrition science officer until the latest follow up, which is W's is 14th month. Okay, this picture show that the graph of W's weight for age, and as you can see the star in the picture, the weight for age for W's is in the third SD, which is more than the third SD. However, as you can see from the 6th month to the 14th month, the line did not spike up, but it stay low following the line of the third SD. Second picture show that the height for age for W's, as you can see, W has a normal range of height, which is located between between the normal line and the 2SD line of her height. So this is considered normal for W, and yeah, it's considered normal. Next is the dietary measurement of W's. We are using a 24-hour diet recall. As you can see, the diet recall for W is kind of normal for a normal kid. She gradually eat approximately 3 times to 4 times formula milk, and eat 2 main meal, or sometimes 3 main meal, which is breakfast, lunch, and dinner. And there are several snacking, such as in the morning and in the evening. Next, the dietary interpretation based on the dietary measurement is that W do eat well based on her 24-hour diet recall, but eat too much and frequent high-calorie snacks such as a tiger biscuit and keropok lekor. And next is extra milk consumption, which is 3 to 4 bottles per day, which can lead to extra calorie intake. And the fourth one is lack of vegetables and fruits intake. For the nutritional diagnosis, first is over milk consumption, evidenced by the 24-hour diet recalls, which up to 2 to 4 bottles a day. The second one is an inadequate intake of fruits and vegetables, and the third one is the over unhealthy snacking, which cause over calories in a day. And proceed with the nutritional intervention. This intervention was done by face-to-face discussion and counseling with Mrs. X and W. Some reference from pamphlet about childhood obesity with the consequences and pictures of the food presentation. This counseling session has about 5 key points, which is the first is try to reduce the milk consumption to 1 to 2 times per day with only 3 scoops of 8-ounce water. Reducing the total scoop use will reduce the calorie in the milk. The third one is do not reduce the main meal during the lunch and dinner, because W still need those nutrients, vitamins, and minerals for growth and development. The third key point is to allow W to play outside of the house to increase her physical activity instead of staying in the house and watching TV or playing a smartphone. This physical activity can help to burn excess calorie that W consumed earlier. The fourth one is try to avoid giving a sweet snack like ice cream or biscuit too often, instead replacing it with fruits or vegetable as snack. The nutrition science officer suggests to give the carrot, cucumber, banana, papaya, as it is cheap and have a friendly taste and smell for the kids. The fifth one is try to talk to the family members not to give W any food with Mrs. X permission, and try not to eat the snack in front of her. This is because Mrs. X always complain that other family member always give W foods whenever Mrs. X not around in the house, and whenever the W ask for them for food, they will give it to W, and most of the food given is not healthy food. Next, for nutrition monitoring and evaluation, the future appointment has been set up for the next 2 months. This is because it is not easy to control a kid from growing up. Thus, 2 months is suitable for monitoring W's progress. And next, for the next appointment, another 24-hour diet recall will be performed to see whether Mrs. X follow the recommendations suggested by the nutrition science officer for W, and Mrs. X also told to do a food record for W. As for the discussion, managing a childhood obesity is completely different from the adolescence or adult obesity. This is because we cannot cut or put the children into the strict diet or cut the calorie intake of the child. This is because nutritious food in a right amount is important for them in the phase of 0 to 2 years old for their growth and development. Limiting their food intake will disrupt their growth and development. Parents must show interest and support for the kids' activities, such as set and achievable goals that fits with your child's physical ability and preferences, and parents also should show a good example and make the physical activity as a family activities. Next, prepare foods that highly nutritious and heavy will increase the child's satiety and feeling full. This will help the child from craving unhealthy snack and milk all the time. Lastly, kid needs the milk, but the nutrient in the milk is not enough to fulfill their body needs for vitamins and mineral due to organs and body needs of the other nutrients and mineral that contain in the food but not in the milk. For the conclusion, W showed an incredible improvement as shown in her anthropometric measurement over a few visits and consultation. Next, her BMI gradually decreased even though her weight kept on rising. Her mother also reported that by giving fruits and vegetables as snack is a good step. W only drink her milk twice a day, which is after sleep in the morning and before sleep in the night. W's BMI and weight is still in the 3SD, which is more than 3SD, but if the effort is continuing for the next 4 to 6 months, her BMI will be less than 2SD or drop to normal. That's all for the presentation for my case study, which is childhood obesity. However, the nutrition assessment and intervention is based on how the nutrition science officer in my Klinik Kesihatan Chukai do, and this is not a complete way like we learn, but this is how they practice in the clinic. So that's all from me. Thank you.